Hi, this is Dr. Toby, your host on Health and Wellness. I invite you to watch our show this week. It has an incredible guest on it, Minister Frederick Lewis. He is a COVID survivor. He is a math teacher in the Worcester Parish system. He's also a father, a pastor, and a husband. He's going to share his experience with COVID-19. Minister Frederick Lewis lost his father, his mother, his brother to this dreadful virus, and he's going to be sharing his heart on how we as a community in the city of Monroe and in surrounding areas can fight this virus and defeat this virus. But not just that, he's going to be speaking from his heart about how to stay spiritually inspired, motivated, and passionate about Jesus after losing people that you dearly love. You don't want to miss it. This is Dr. Toby Moma inviting you to watch our show, Health and Wellness, on this station. Don't miss it. You'll be blessed. God bless you in Jesus' name. Hi, this is Dr. Toby, your host on Health and Wellness with Dr. Toby. It's a pleasure to have you on our show. What a delight, what a pleasure to have you today with us. I have a special guest on the show, Minister Frederick Lewis. Am I correct?
Yes, sir.
He's the minister at Heavenly Travelers Ministries. He's a father of two, he's a lovely husband of one, and he's a mathematics teacher who trained at ULM, University of Louisiana Monroe, for his undergrad, and then went to Grambling for his master's in teaching. He's a young man who has done great things. As many of you may have heard, he was recently running for mayor in the city of Monroe. But he's here today as a patient. You see, as a physician, I can tell you that many times we doctors don't take the perspective of the patient into consideration. We make decisions unilaterally without making conversations with the patient about what we want to do. And I felt that we've been talking to doctors, we've been talking to social workers, we've been talking to all professional aspects of, professors of different fields. I wanted to talk to somebody who we have never heard from on this show, Health and Wellness with Dr. Toby, the patient. And our guest today, Minister Frederick Lewis, was recently a patient in the hospital. I want you to share your story with us. What took you to the hospital this year?
Well, we were released, as you said, I'm a school teacher, so we were released from school in March, and about a week, maybe 2 weeks later, I contracted the COVID-19, and it actually ran through my family, and so it got terrible. There were 5 of us that were hospitalized with the disease in my immediate family. And even in that immediate circle, my brothers and sisters and my parents, there were actually 9 of us that came down with it. The 5 of us ended up in the hospital, and out of the other 9, they were able to get over it without having to go to the hospital.
Tell me a little bit. You went to LSU Shreveport, or you were transferred to LSU Shreveport?
Well, actually, I didn't go to make it to LSU Shreveport. I was in St. Francis here in Monroe. And what happened, my brother was initially the one who had it, and he was in contact, of course, with his wife, so she got it from him, and then my parents got it. My sister got it. One of the children got it. I had it. I got it from my dad. I ended up affecting my wife with it, and so it was just wildfire.
Were you all treated locally, or some of you went to Shreveport?
We actually were treated here locally,
all
at St. Francis.
Okay.
Yes, sir. And it was one of those things where it was in the early part of the disease.
Right.
And so a lot of people didn't know how to approach it, what to do with it. They treated some of us and released to go back home, where they really were just testing to see if you had the disease.
Early March, everybody was still touch and go. Nobody
Yes, sir.
really knew. Give me an idea of did you go to the clinic first? Did you go to the hospital first? Did you go to the ER first? Tell me about your clinical hospital experience a little bit as a patient. Because as a doctor, we don't see what you see. I wanted to get, was there a, what did you think of your experience overall?
Well, for me, it started when my dad he had just retired at the end of February. So by the time he had contracted the disease mid March, he had to have surgery on his foot. So had already been to the hospital, and when we first suspected that it could be COVID or something like that that was affecting them, by that time my brother and my mom had already gone to the hospital. He called me because he was in pain, and he was saying, "Well, I need to get to the hospital. I'm dealing with some issues with my foot, and plus, I think I may have COVID. I'm not sure. Um, I need you to go give me some soup." So I went, got my dad some soup, and as I was there talking to him, um, uh, and this was a couple of days before he actually had to go. He was just telling me how, that he was tired and everything like that, and so he called me again the a day or so after that and said I need to go to the hospital. So at that time again, nobody really knew how
Everything,
to
yeah.
deal with COVID in its fullest sense. So I basically wrapped up. I put on a sweater. I had a handkerchief, a bandana around my face. I put on a hat and everything because I wasn't sure if that was what was going on. But by the time I made it to him, he could hardly move. And I wouldn't find out exactly what he was dealing with until a little bit later, when I had the disease myself and finally got to a point where I knew what he was going through. I put him in the car. I literally had to help him because he really had no strength whatsoever. And I put him in the car and took him to the hospital, and we got him admitted. And I went back home, and at that particular time, because I just wasn't sure about things, I my wife and I were she was staying at her mom's house. We didn't want to take any chances with anything. I went to stay at the house by myself for a few days, just needing to quarantine. Um, but as I was by myself, I, I I'm not even sure how many days it was after I had taken him to the hospital. It may have been 4 or 5 days where I began to feel like, I'm not really hungry. I tried to go and buy myself something to eat. I couldn't eat. And the fatigue started setting in where like I was just tired. And even at night, I started sweating at night. And there was a slight fever. And I was just constantly trying to, make sure that I maintained fluid concentration and that I really tried to take care of myself. But starting on that Monday of the next week, um, I couldn't eat. I tried. I tried to swallow things, couldn't do it, and so I really was on a kind of a liquid diet where water was really the only thing that I could
And let's
take.
just make it clear, you had no medical problems before this. Like,
Yeah,
were you
actually,
diabetic or
yes. In my
hypertensive?
family, there's a history of diabetes in my family, and it's actually on both sides, my mom's family and my dad's family. And prior to my COVID contraction, I was dealing with some diabetic issues and everything. But having gone through this, having gone through the issue of COVID, it put a highlight on, of course, those pre-existing conditions because
Right.
of the way COVID affects. But my experience with COVID was even different from the rest of my family's experience with it because the other four that went into the hospital with me, they were affected respiratorily. COVID did not affect me respiratorily,
Respiratory.
and I didn't have any difficulty breathing. Really, it mainly affected my appetite, and it affected my strength. I, when I say literally, I could not even take myself to the bathroom on a regular basis, just in the ease of getting up in the middle of the night, come back to the bed, I had to crawl to the restroom. I had to make myself, push myself to get up because it was so difficult dealing with the lack of strength
Did
that
you
came from that.
call the primary care physician or his office, or did you make any inquiries before you went up to the hospital
No,
eventually?
actually, I did not. And what sent me to the hospital was I gone the week that was that Monday I started. I gone gotten to that Saturday of not eating, and I told myself you have to eat. I tried to force myself to eat, so I went and got a little salad with a little grilled chicken on top, and I broke a piece of the grilled chicken off and tried to eat it, and all of the water that I drank just came up.
Okay.
Yes, and it
Wow.
was just everywhere.
You could still taste it, though.
Yes,
Oh my
yes,
goodness.
and so immediately I called my wife. She was still at her mom's house, and I said, I think I need to go to the hospital. Um, I've dealt with dehydration before, and I was feeling kind of dehydrated. And I said I need to get to the hospital. At that particular time, she was like, "Well, do I need to call the ambulance for you?" And I said, "No, I think I can make it. Just let me drive. Just come and follow me to the hospital." So on that Saturday morning, by that afternoon, I'd gone and checked myself into the hospital.
Okay.
They ran a battery of tests, of course, COVID tests. They wanted to see if it was another respiratory infection, pneumonia, flu.
Right.
They just ran a whole panel again because at that time there wasn't a certainty about what you were dealing with,
Mm-hmm.
because of course I had a history of being dehydrated before. They wanted to just make sure that they checked everything, and so for the rest of that evening, I think maybe for about I was in the hospital maybe 12 hours, and was on IV, in the ER. They kept me. They checked on me. They ran the test, and they said we're going to get your results in a few days. So what we'll do is we'll just send you back home. We need to make sure that you're eating something because by this time I still hadn't eaten anything.
Exactly.
And so when they sent me home, it was after midnight into Sunday morning, and so I stopped and tried to get something to eat, but of course everything was closed by that time,
Mm-hmm.
and I went home. We had some soup at home, so I said, "Well, I'll just go to bed, and in the morning I'll try to eat." My wife called me, came by to check on me, and by this time she decided, well, you know what, I'll stay here with you. So she was in the house with me, and we were trying to get me something to eat and put some things in me, and it just wouldn't stay down.
Wow.
By that Tuesday morning,
Wow.
Monday evening,
So almost a week not eating anything.
right, almost a week not eating anything. They when they let me go out of the ER, they told me to follow up with my primary, and I called my primary, and we conducted an over the phone interview. She had asked me about what had I been able to eat anything since I left the hospital. I told her I put down some soup earlier in the day, but by the afternoon it was coming up. You know, I couldn't hold anything down. My taste buds were off, and so she told me, well, I need to send you back to the hospital. And this time I need them to keep you. And so I went back to the hospital, and that was when I checked in and I stayed in the hospital for the next 4 maybe 5 days. And during that time, I was miserable. Again, fatigue. I could barely lift myself. When I had called my primary physician, as a matter of fact, Erica was still at her mom's at this time, and I told her I need to go to the hospital, and she asked, "Could you drive yourself?" I said, "Yeah, well, give me a little while to put on some clothes." It ended up taking me about 3.5, almost 4 hours just to get dressed. I
And you are an athletic. You are very athletic.
Yes, sir. And it reminded me of when I went to pick up my dad that day,
Wow.
of how he had just sat on the bed and couldn't even put a sock on. By the time I was able to just put a shirt on and put some pants on, I had to put my shoes on. And in the process of trying to put on my shoes, I couldn't even, I sat down in the closet just trying to breathe and get myself together, and I could not put my shoes on. And so I called her back and said, "Baby, I need you to call the ambulance and tell them to come pick me up. I can't put my shoes on." And it has so affected me. Um, and by this time, of course, I'm losing weight, and I'm already not a very big guy to begin with, and so the weight is still coming off. And when she called the ambulance, I had a wherewithal just to put some stuff in the bag and lay on the floor until they got there. And by the time they got there, um, I crawled to the door and let them in, and they finished getting me ready
Wow.
and put me in the ambulance, and I went to the hospital that day.
Wow. All right. Thank God you called your primary, because a lot of people don't have primary care physicians. They just use the emergency rooms, and
Yes, sir.
unfortunately, you miss a lot of benefits by not having a primary care doctor. So that's one of the benefits I wanted to highlight today, that you had a communication with your primary
Yes,
care
sir.
physician.
Definitely.
So so this is 6, 8, almost 9 months, 8 months since you had this episode. You've shared your story with people. Have you been looking back, and I'm not going to go into the details of what happened to the rest of your family, but your story, how has it affected people you've shared it with? Have you shared it in public? Have you shared it with the church? Have you shared it with your friends? And has it helped you? That's basically what I'm trying to say. Does sharing your story help you heal the hurt, or does it make the hurt worse? Because it's important that we let people know this aspect.
Yes, and actually, it's kind of a two-edged sword. It helps to be able to talk about it because you have to deal with what you went through. As with any healing process, you can't heal unless you deal with the issue.
Right.
And for me, that issue revolved around my illness, the fact that my family went into the hospital with me, the fact that not all of us made it out. And for me, there are so many people that are connected to us all across the city. Here in West Monroe, I come from a large family,
Right.
a very large family on both my mom and my dad's side. And even now, as I meet people for the first time, of course, because even coming out of COVID, we quarantined for a long time. I did not get back to full strength and full health until maybe 2 or 3 months later, to where I was able to kind of go outside and,
Campaign for mayor. Right?
yeah, in the process, all while campaigning for mayor. Yes, sir. As I meet people now who haven't seen me since then, colleagues, co-workers, they share the fact that they were praying for me in the midst of it. They were praying for my family because a lot of people know my family. My family has been connected in the community for years, and just with the length and breadth of the lives that they have touched in the process, my parents just know people, and people know me through my parents, and of course through my own personal work, teaching school, working in after school programs. I've worked here in West Monroe. I've worked in Monroe with Ouachita Parish School System, in the Monroe City School System. A lot of people know me through a lot of the experiences that I've had and I've shared with our local community. And of course, in the process, like you say, running for mayor, a lot of people that did not know me got a chance to see me before I got sick, to see that I was running for mayor and understanding the platform that I was running on. And it just became a vehicle that connected me to so many people. And now as I see people and they talk to me about things and they want to know, tell me about what you went through. I know somebody right now that's going through or that's been affected by, and so they ask me for those stories and they ask me to share that story. And even just being able to talk about it, of course, it brings back the pain of what you're dealing with, but you got to understand somebody's needing that, because really when we look at the areas of ministry and me being a minister, sometimes you understand that your pain is somebody else's promise, and that sharing that story will actually help people to deal with and go through what they've gone through.
Mm-hmm.
And even with my wife and I, we had a daycare a year or so ago, and one of the ladies that worked with us contracted COVID in the process, and immediately she called us and wanted to know how we went through
Right.
what we went through. And regretfully, she succumbed to the disease as well. And that was another thing that just really kind of hurt our hearts.
So it's like the Bible says that through the comfort that the Lord has comforted you, you are able to comfort others. You know, the
Yes,
Holy
sir.
Spirit is the comforter, really. So what I'm trying to say to people watching is when you talk about things, there's a healing. When you bless other people, you're like a faucet, water flows through. You will not be dry. You water other people, but you also get watered
Yes.
in the process. So I tell a lot of the African American community shy away from behavioral counseling, going for therapy sessions, marriage therapy sessions, family therapy sessions. They look at it as, oh, they think I'm crazy, they think I'm a shrink, but it's okay to talk about things. Nobody's labeling you, but when you discuss with somebody, you don't have to talk to the whole world like Minister Lewis is doing, but you can talk to somebody like a counselor, and it helps lift the burden on your heart. There are people who want to hear what you have gone through because it will help you, and it will also help other people who listen. You
Yes,
know.
and one of the things that even as we talk about healing, because it really that's what going to therapy and to deal with those kinds of things when we are hurting, what that does is that helps us to heal. Because even if we look in the natural sense, the body is made to heal itself. If you break your leg is automatically going to heal. But the thing is, if you don't allow it to heal properly, you'll forever walk with that limp.
Mm-hmm.
And so sometimes what we think is our process of healing, we don't really heal in the right way until we take it to somebody that can help us know that,
Right.
okay, I've been healing in the wrong way.
Mm-hmm.
Where sometimes the trauma that behind what we go through has left us embittered. We
Right.
didn't heal the right way. We're healed.
Mm-hmm.
We're mended again, but we're not healed in a
Healing.
way that can benefit ourselves or other people. So for myself, I don't shy away from the prospect
Mm-hmm.
of dealing with counselors to help through the grief
Right.
and the grieving process that we go through, because it is sometimes beyond the scope of our own understanding in how we need to heal, because
Mm-hmm.
there's a certain way that God intends for us to heal so that we don't become a menace to ourselves or a
That's
menace to
right.
anybody
Mm-hmm.
else.
A man of God once said, "Hurt people hurt others." So, if you're hurt, you can't heal people. You're just gonna be. I think the Bible says in Hebrews that your bitterness defiles many. You know, so how you've got to heal to be a
You got to
blesser.
heal.
You've got
Yes,
to
sir.
be a healing stream. 1.3 million people, as at last week, have died from COVID. 250,000 in America. That is a lot of people. My father died in July. It wasn't COVID related, but it was a loss. You've lost people. You lost, and I didn't want to bring it up until later, but I just want to bring it up now. You've lost your dad. You've lost your mom, your brother, and you said now somebody who worked with you to COVID. So this 1.3 million people, it's personal.
It is. And even as I watch the news and they have that number of people died from COVID, on there, I often count in my head my four people that I lost. My mom, my dad, my older brother, and Miss Williams, of course, who worked with us at our daycare. Those were some really important people to us. When we went into the hospital in mid March, the day I dropped my dad off at the hospital and they admitted him, I did not know that was going to be the last time I saw him. Even dealing with the issue, of course, this is the other side of that two-edged sword. You get the joy of
Right.
sharing and benefiting others through your testimony, but it also reminds you of what you lost. But you know, I thank God for the strength that they gave me, because it is what allows me to be able to talk about their absence in my life even now. And so, um, my mom, um, she was the first one to pass with COVID. At the time, all five of us were in the hospital. Um, I was the last one to go in or to go back in. Um, by this time, my my older sister, my older brother, my mom, my dad, and myself, we were all in the hospital. And by the end of the week, when they released me the second time, I came home and they had decided that they were going to put my mom, my dad, my brother, and my sister um, all under sedation and put them on respirators.
The
Yes,
ventilator.
on the ventilator. Yes, sir. And so at this time, you, not only am I dealing with everything else that's going on,
Your health issues.
my own health
Right,
issues, um, I'm concerned about them,
right.
trying to make sure that they are all right, um, because they're under now. And for me, now I'm the one that has to try to make sure that the family is staying together, to try to make sure that we got everything where it needs to be. And so the bad part about it for me with my mom was that out of all of us that had gone in, my mom seemed to be like the one who was doing the best. And all of a sudden, her health just fell off the cliff, and it was sudden. And you know, um, it was April 5th, and when she passed, and at that time when she passed, it was really hard to deal with because, of course, you're in the early stages of COVID, so nobody really knows
No,
how to respond. Nobody
right.
really knows what to do. Nobody, even though you've heard about how bad the disease could be, we'd heard the same thing about the swine flu and the bird flu and these,
Ebola and all
yeah,
that.
Ebola, and it didn't turn into this kind
This
of
kind of
pandemic.
stuff, right?
And so when she passed, it shook me to my core because when at that time you're thinking, okay, we, we've contracted the disease, we're gonna go in, we're gonna come out all right, because by faith that's just what you believe.
That's
You
right.
know, nothing's gonna happen.
Minister
You know,
Frederick, you see that clock is telling us that we need to cut down. We're going
yes,
to
sir.
continue with Minister Frederick Lewis next show. He's going to tell us what happened in the hospital. 5 of them, 2 came out, 3 didn't. And he's going to share what happened and how he's gone through it in the last 5 months. You don't want to miss it. This is Dr. Toby Health and Wellness. I'm telling you, you've got to hear this story from Minister Frederick Lewis. It's going to bless you. It's going to teach you a few things about how you too can come out of your dark situation. I believe God can heal the brokenhearted. I believe God can turn situations around. The reason I'm sharing this is because I want to get the patient's perspective. Somebody who went through COVID is sharing his experience. You don't want to miss it. Check us out on faithandpower.com. We're always here on the show. We're always here every last Friday of the night, 11 p.m. at the Oyo Hotel on 1051 Martin Luther King Drive. We're going to be there on December 18th. We're going to be there 11 p.m. to 4 a.m. Don't miss it. We're going to have a great time in God's presence. Look forward to seeing you there. Join us. Jesus is Lord. God bless you.